Good evening, everyone. Welcome to the Helping Hands HIV/AIDS Alliance. I'd like to introduce you to our team. Kenisha Oliver, Phoenicia Providence, Marshall Times, Tamara Wallace, and yours truly, Shamika Powell. For a number of years, families living with HIV/AIDS across the St. Vincent and the Grenadines have experienced discrimination both in the workforce and in the educational system. This is due to the fact that they do not have constitutional rights. On October 1st, 2018, the Helping Hands HIV/AIDS Alliance was established by 5 early childhood professionals across the Caribbean with the main intention of addressing these issues. The core values of our organization are guided and informed by our belief and commitment to care and support. We believe in non-discrimination for all. Integrity. We are driven by a clear focus on honoring our commitment and trust. Equality. We believe everyone is equal and should be treated with respect and dignity. Innovation. We find solutions using a pragmatic approach and innovative thinking. Teamwork. We work together in harmony. We respect and value each other. Accountability. We utilize accountability and transparency in all of our endeavors. Ms. Phoenicia will now present the vision, beliefs, and mission of our organization.
Thank you very much, Shamika Powell. Good night, everyone. My name is Phoenicia Providence. The vision of the Helping Hands HIV/AIDS Alliance is to become the leading non-governmental organization in St. Vincent and the Grenadines, fully empowered to reduce the spread and impact of the HIV/AIDS epidemic through education and the delivery of services with other stakeholders without stigma, fear, or hate. Equally important, we are the voices for Vincentian children and families. Hence, our mission is to reduce the spread and impact of the HIV/AIDS epidemic through facilitating implementation of workplace and school policies, as well as programs that focus on behavior change, reducing stigma and discrimination, and creating supportive environments for children and families living with HIV/AIDS. Following, our objectives are to provide legal advice for families whose rights are being infringed as it relates to HIV/AIDS, to facilitate access to medical services for testing and social centers for counseling to children and families infected or affected by HIV/AIDS, to develop comprehensive and evidence-based health and livelihood interventions through a family-centered and integrated approach for vulnerable and marginalized Vincentian children and families, to respond to diversity by meeting the different circumstances and needs of all children and families affected by HIV/AIDS, to work in partnership with the Ministry of Health and Education, providing health and safety guidelines for schools on the treatment of children infected with HIV/AIDS, and lastly, to advocate for affected children and families who experience stigma and discrimination. I will now hand you over to Kenisha Oliver, who will introduce the partnership with other agencies. Thank you for listening.
Realizing that there is a need to partner with local and international agencies to ensure that our objectives are met in the most efficient and effective way possible, the Helping Hands HIV/AIDS Alliance sought collaboration with the following agencies: the St. Vincent and the Grenadines Human Rights Association, the World Health Organization, and the Pan American Health Organization. The St. Vincent and the Grenadines Human Rights Association was established in 1986. It is the only human rights organization in St. Vincent. It is committed to promoting and protecting the civil, political, economic, social, and cultural rights of our people through education, training, representation, documentation, advocacy, and by networking to influence both the government and other agencies. Its main objectives are to promote the observance of human rights, educate the general public on human rights, collate, record, and publicize human rights abuses, and seek ways to remedy these abuses, process complaints on infringement of human rights through the courts. Why the St. Vincent and the Grenadines Human Rights Association, one might ask? It has been documented that advocacy works best when the key players collaborate. This collaboration provides a medium for varied skills, knowledge, expertise, resources, all in one place geared towards a positive outcome. The St. Vincent and the Grenadines Human Rights Association is an ever-present voice in our nation. It seeks to protect and serve through workshops, seminars, and the hosting of media programs. They have also conducted projects on domestic violence, women's human rights, and children's rights, including child abuse. They have conducted a series of town and village meetings, educating the public on domestic violence, radio programs and television programs on social issues such as HIV and AIDS, and its stigma and discrimination. They also provide legal consultation to persons in need, and most of all, they provide non-governmental organization report to the United Nations Child Rights Committee in Geneva. I will now hand you over to Tamara, who will expand on our relationship with the World Health Organization.
The World Health Organization, our international agency for partnership, is an integral part of the United Nations effort in several key areas, which include immunization, health education, and ensuring that essential drugs are available. The World Health Organization main focus is on health issues globally, who began its constitution when it came into effect on April 7, 1948, a date which is still celebrated as World Health Day. Its population is over 7,000 people working together in 150 different countries in 6 regions. Its headquarters is in Geneva, Switzerland, and their primary goal is to direct and coordinate international health through life course, health systems, preparedness, communicable and non-communicable diseases, corporate service, surveillances, and response. Why the World Health Organization? It was chosen because it is an agency that helps families with HIV, and it is working in several different countries to sustain and increase the treatment, prevention, and as well as care for HIV, whose main priority is in the area of health care, and they're moving toward universal health coverage and works together with global health partners, civil society, policymakers, as well as other private sectors in support of countries in implementing, developing, and monitoring health plans at the national level. Additionally, WHO is in support of countries to assure that there are equitable, integrated, people-centered health services available at affordable prices that are effective and safe health technologies, as well as strengthening health information systems and policy making that are evidence-based. I now turn you over to my colleague Rochelle Tanis, who will continue on our international agencies.
The Helping Hands HIV/AIDS Alliance will also partner with the international agency PAHO. The Pan American Health Organization, otherwise referred to as PAHO, was created in December 1902 as a result of the 1870s yellow fever epidemic that affected countries such as Venezuela, Brazil, and South America, and spread as far as the United States 8 years after. For 110 years, PAHO strives to control the spreading of epidemics from country to country, protecting the health of its people and the economies of its member countries. It is governed by 3 main bodies: the Pan American Sanitary Conference, the Directing Council, and the Executive Committee. PAHO's headquarters is in Washington, D.C. in the United States of America. It operates in 27 countries, including St. Vincent and the Grenadines. Why PAHO? PAHO is recognized as being the specialized international health agency for the Americas. It is also the regional office for the Americas of the World Health Organization, WHO. PAHO's works includes improving and protecting the health of people throughout the region, in areas such as communicable diseases like HIV/AIDS. It works to strengthen the health systems to make them more stronger and resilient, and works along with the Ministries of Health and the government and NGOs such as the Helping Hands HIV/AIDS Alliance in providing technical support in areas such as health services and providing universal health access and coverage for all. It also works to strengthen the human resources in the health fields and to provide safe medicines and improve the health technologies used. In conclusion, the effects of HIV/AIDS have touched the lives of many Vincentian families and children in one way or another, mainly through discrimination. As a result, it has affected the quality of services such persons receive and has reiterated the need for the intervention of the private sector. Therefore, the Helping Hands HIV/AIDS Alliance was established to bridge the gap between rhetoric and theory, and is working assiduously with local and international agencies to respond to and adequately meet the needs of the families and the children affected by HIV/AIDS. I thank you for listening to our presentation, and I hope that in the near future you would be assisting the Helping Hands HIV/AIDS Alliance. Thank you.